Welcome back. Tonight we are focusing on the community intervention and what is happening at the community level so far with this pandemic that is with us now for almost now 3 months. The Ministry of Health has of course said that the infections are almost reaching to its peak, with now the government focusing on home-based care. We have community leader Mr. Peter Kenyua to sort of interrogate some of these issues and talk about how possible home-based care is at the community level. Welcome, Mr. Kenyua.
Thank you.
All right, first things first, before we even talk about the home-based care and how possible it is, perhaps you could explain some of the challenges you're facing so far, given that the numbers have continued to rise despite the measures put in place by the government.
Okay. Thank you. I think we need to appreciate that much has been done on this COVID-19 prevention and management. And I think the government has done a lot on the issue. But as we all know, there hasn't been full control of this COVID-19 challenge. But according to my opinion, there are challenges of maybe people who are not able to have what is necessary. For example, not every person may be able to have all what is necessary for us to prevent this COVID-19. But I am aware that there has been massive distribution of masks, sanitization, and even people have been sensitized to make sure that they are keeping distance. However, there are challenges maybe for those who are maybe lacking, maybe feeding and what have you. But I am aware that the county government has been giving food to almost most vulnerable people. So a challenge there is that there are those who may not have been satisfied by the provisions of the government, but I think the government has been trying to make sure that they are reaching the most vulnerable people. What I've seen, there are many people who have had a good heart for maybe assisting those who are needed through the committee that has been set by the government, and I think they have been doing a good job. You remember that at first there were pleas that those who are able to contribute to the COVID-19 national team, they were being requested to do that initiative. But you also know that there has been other initiatives that have been maybe giving food at an individual level, which to me, although the government said that we should contribute to the national committee, it is good when people visit one another in terms of giving them livelihood, because I believe that's a challenge that even now, like those who are in the outskirts of Nairobi are facing. It is good to know that the government is trying much, but they may not be able to do each and everything.
All right,
Yes.
that you have raised. But let us now talk about the home-based care, which is something the government is looking into, given that the numbers have continued to rise and the hospital are almost being filled to capacity. In your community level, have you had some sort of awareness when it comes to home-based care, and has it started? We understand the government has had a pilot project, but now at the community level, are you foreseeing the situation of home-based care with those people who have been affected by COVID-19?
Okay, thank you very much. I think it is a time that it is decided on the way forward, because I believe home-based care can be productive, noting that the numbers, as you have said, are increasing. And although we may not be sure about tomorrow, if the numbers continue to increase for those who are positive, it will reach a time that those who are not fully sick or those who are not showing any sign may not be necessary for them to be admitted in an hospital. I personally support that government initiative of home-based care if it can be well planned and if it can be well followed, because it will create a very big impact. Because as per now, not many hospitals are able to receive many maybe clients of COVID-19. because of the limitation of maybe their capacity, the limitation of their capacity.
But there has been, some have said that there is a challenge, there are some challenges when it comes to home-based care for treatment or care due to some of the neighborhoods in every community. There are different communities. There are those who are well off, there are those who are not quite well off.
Yes.
Perhaps, don't you think the government should look into this particular case?
Yes, I think going forward, if I can comment on my area, Loido, where I am a resident and I'm a community leader, I think there could be challenges when maybe the government starts rolling this program, because there are those people who maybe stay in single rooms or in very small houses. There could be a challenge of space, whereby you are not able to segregate yourself away from other members. You know, in home-based care, it is supposed to be carried in a way that you don't maybe stay or live with the other members of the family. You are supposed to maybe to use your own bathroom, toilet if possible, and even the utensils that you are using must be different from the other members of the family. So there could be a challenge of space, a room, so that you may not infect the others, because it can be very dangerous if you infect the others even as they care for you. The other challenge is that where you are, there should be running water, which actually is supposed to be adequate. Mm-hmm. But you see, there could be areas where there is no running water, although I think not many places without water. The water can be a challenge. Mm-hmm. And according to this challenge of COVID-19, you know that it is, because it is affecting the maybe breathing system, the house is supposed to be well ventilated. There are some single rooms that we live year out, which may not be able to be adequate when it comes to somebody who has been tested positive and is in the home-based care. So there are challenges, but I believe those challenges should be looked at so that people can utilize.
All right. Because as a community leader in your own community,
yes,
perhaps what are some of the interventions or initiatives the government should do to ensure that the community is prepared to handle the home-based care? Because there's one thing of saying that we are going the home-based care way, but there's another of being keen to look that interventions are done at the community level to ensure that people are sort of equipped to handle the patients, because it is a disease like no other that you've seen before.
Yes, thank you. According to me, I think, and as I've said earlier, home-based care can be very productive, especially in areas where they are tested and many have been held to be positive. But I think as the government is continuing to equip some of the facilities, a time may come whereby they may get specific spaces for isolating those people who have no capacity to be at home. Mm-hmm. That means instead of them being segregated in their houses, they are taken to a certain center. Mm-hmm. And here I think it's not necessarily an hospital, but it can be a center that is made or that is selected and equipped for the purpose of that. Maybe as a public facility, so that those who are not able to be cared for at home can be cared for there. But you know that one also will need good selection and mastery, because not many, it will need also a lot of mastery so that it can be well monitored to make it successful.
All right.
Yes.
Perhaps what have you sort of witnessed in communities around you, not only Ruiru? We have had the issue of the Nyumba Kumi initiative, which is said to be quite a tool in the community by ensuring safety in terms of security. Have you sort of implemented the Nyumba Kumi initiative when it comes to COVID-19 pandemic to ensure that outsiders are not there, and also to ensure that everyone is being monitored in terms of adhering to the measures put in place?
Yes, I think that's an area that is of good interest, because in many parts of Loilo, the administration has been very vocal in coordinating the office and the local leaders. And I think that's an area that has been doing very well because like an area here called Katongola, the chief, Mr. Ntweg, has been moving around, connecting with the Nyumba Kumi to map visitors who come to the area, even not just COVID-19 patients, but even visitors, so that they can be monitored and then it can be known where they're coming from, so that they may not lead to the spread of this disease. So, to me, I think the Nyumba Kumi has been so effective, and I think going forward it can be one of those tools together with the CHVs, which can be very effective in monitoring the home-based care, because you see, home-based care needs people who have been trained to look and master or monitor what is happening.
All right.
Yes.
Let's now look at the issue of the stress factor. The COVID-19 pandemic has, of course, brought a situation that is uncommon. We have had increase of cases of domestic violence. Now we are talking about teenage pregnancies, which is somewhat related to how moral a society is. As a counsellor in the community level, what are some of the issues that you are putting in place that can be embraced in different community levels?
Okay, I think from the one go, I'm in the record of saying that we will not advise for maybe total lockdown or the way we may call it, because the country needs to go forward. Some of us know that if situations continue to be like this, there will be more trouble, which will be in the social circles of the community more than the COVID-19. So we expect some of the challenges, as you've mentioned, if people stay the way they are staying at home. You are mentioning of the teenage girls being put into a situation that they are not supposed to be put into. Although I may not talk much about that, but you expect some of these challenges, because when people get inside, and some are not even working, and then you see, that's a very big challenge on the scene. So my take is that we are trying to make people not to stigmatize one another by telling the community that if anyone is positive, he should be taken, or she should be taken like one of the community or member, and not to be segregated, because stigmatization can be very serious. And that's why we are also advocating for privacy. If somebody has been taken as positive, it's not a must that he must be said aloud, because he has to pass through the process that is necessary, that has been allowed by the government, and that one, as he heals, as he gets once becoming negative, he will get healed and join the community. So we are advocating against the stigmatization, those who are positive. And on the other hand, we are also advocating for good sensitization without massive enforcement and maybe forcibly enforcing the people to follow the government directives. Because at the end of the day, people are supposed to follow what has been laid down by the government without being coerced, because it is a personal kind of initiative to make yourself safe. So for my part, I've been sensitizing them to follow the government or the Ministry of Health guidelines so that they can be safe.
We have talked about the issue of stigmatization when it comes to COVID-19, but some have said, and the issue of privacy, some have said that they want to see those people who have been COVID-19 infected so that they can ascertain that this disease is with us. Perhaps have you had the stereotype in the community that COVID-19 is not here and the government is just but inflating numbers so as to get donor funding? Has it been something like a challenge when you're creating awareness about the disease at the community level?
Yes, actually, there are those people who believe that COVID-19 is not within them because they have not seen somebody or they have not been touched.
Infected, yeah.
Yeah, they have not been infected. However, I think I should tell them that COVID-19 is real and it has been affecting many people. It's lucky enough that God is merciful in Kenya. We have not experienced this serious deaths, but COVID-19 is a killer and it can affect. So we are trying to tell them that they should be careful and they should take guidelines from the Ministry of Health very seriously, because at the end of the day, if somebody is infected, he will not even be able to know what has happened. So it is real. Those who are saying that the government may be doing its own things, I think that's not the way. The government may not have business in using the numbers to lie to the people. However, I may not talk much about that, but I'm aware that the disease is there, and if each and every person should take it as a personal initiative. That's what I'm advocating for, to make sure you are safe. When you are safe, the other person is safe.
Right.
Yes.
So perhaps what can be your way forward when it comes to looking at the country and the issues within the country at a scope, from matters education to matters economy to matters welfare? What can be your way forward, looking at it at the level, not at the national level, but at the community level, and looking at the people that you interact with day by day?
Allow me, before I comment on the way forward, I think we should appreciate even what the counties have been doing. In as much as we are talking about the locality where I am a leader here in Loilo, we are also not ignorant of what other areas. There are some